Renal denervation has been chosen as a hot topic for this year's Congress because it has the potential to benefit thousands of patients worldwide with significant hypertension.
It's a very exciting and new development.
Nephrologist Dr. Peter Blankstein was first to take the stage in the Hot Topic Symposium, reiterating that renal denervation was not a new concept, but how new developments have called for new approaches.
And I think it's also fair to say that catheter-based renal denervation is really an innovation. My suggestion would be to collaborate, you as interventional doctors and nephrologists like me as referring physicians, to put as many patients in studies and in registry to learn more about this procedure.
Dr. Clemens Jilek, expert electrophysiologist, was tasked with evaluating any detrimental effects of radiofrequency on the renal artery.
If we put a 60-degree hot tool into a renal artery, the question is this a safe procedure? Can this be a safe procedure?
Dr. Jilek then reviewed the current evidence and alternative energies, stressing the importance of gathering more safety data.
And coming back to the question I had to answer, how bad is radiofrequency for the renal artery? We do not know at this time, honestly spoken, but there are more than theoretical concerns about safety.
Cardiologist Dr. Michel Voskuil presented the studies in favor of a percutaneous approach.
We've now found a way to be less aggressive and with less comorbidity and even mortality that was seen in this early surgical way of dissecting the nerves.
Dr. Voskuil ends his lecture with a summary of the current data.
We have very promising data from percutaneous renal denervation in patients with resistant hypertension, so only a small subpopulation we're still treating. The data are limited, but I think they're very convincing and very in line with each other.
We currently live in the world of evidence-based medicine, and all new procedures have to acquire an evidence base before they can be used safely on patients.
Professor Michel Azizi emphasized the need for independent, randomized blinded studies throughout Europe.
We should also compare the efficacy and safety of different procedures. We should know at the long term what is the efficacy and safety. We should know the impact in terms of morbidity and mortality. We should make cost-effectiveness studies, and we should have a standardized certification for denervation center.
The expert panel concluded the symposium with a question and answer session, shedding more light on the efficacy of the technique and whether more trials were needed before offering this treatment to patients.
For renal denervation, we currently have a number of small trials that show proof of principle in terms of safety profiles, but we currently do not have large-scale randomized controlled trials and/or long-term follow-up. So these are very important considerations for the future of renal denervation.
The panel were optimistic about the future of catheter-based renal denervation, but all called for the urgent need for more evidence and additional, reliable data.
It's important to build evidence that because you do a risky procedure with a patient, and if you have no evidence for that, you end up jeopardizing the patient's safety. So safety, patient safety and evidence go hand in hand.